Well, thank you for joining me today for the Healthy Skeptic MD podcast. I'm Dr. Michael Hockman. My guest today is an old friend of mine from medical school, Joe Ladapo. Joe is a physician at UCLA Medical Center and also has a PhD in health economics and health policy, so he'll be a great person to help us think through the policy side of our response to the COVID-19 pandemic. In addition to Joe's day job seeing patients and being an NIH-funded researcher, Joe is a regular contributor to the Wall Street Journal. And during the pandemic, Joe has written a series of provocative pieces in which he's argued that COVID is a very serious situation, but we've also had a lot of fear and a strong reaction to the pandemic that's been damaging too. And perhaps it's time for us to think about recalibrating our response to some extent. Now, I will say that Joe has faced a fair amount of critiques for his views, and I can say regardless of whether you or not you agree with what you're going to hear today, Joe is a well-meaning guy and very thoughtful, so I hope you'll take all his ideas in and think about them carefully. If you do like what you hear today, please do search and subscribe to the Healthy Skeptic MD podcast, wherever it is that you listen to podcasts. You can also search for the Healthy Skeptic MD YouTube channel. Okay, so before we jump into our interview with Joe, let's do a rundown of the health news of the week. And a lot of the health news has been alarming. So first, there was a CDC report that estimated that there have been about 300,000 excess deaths in the United States since the pandemic began. The CDC estimates that 2/3 of these deaths are attributable directly to the virus itself, while about another third are attributable to the consequences of the virus, such as overdoses, mental health problems, and avoidance of other medical care as a result. In addition, there was a large World Health Organization trial involving more than 11,000 people in 30 different countries that tested a variety of different medications against COVID. One of those medications was remdesivir, which of course has already received emergency use approval here in the United States. Disappointingly, none of these medications proved effective in preventing deaths or reducing the number of days that patients spent in the hospital. And then perhaps most worrisome of all, we had new numbers on the rates of new COVID infections, and rates have certainly seemed to surge from about 40,000 infections per day to about 60,000 infections per day over the last week. So here's my take on it all. First and most importantly, it's really important to take this all in stride. Believe it or not, as I'll explain shortly, there's actually a couple things in here to be optimistic about. Secondly, in terms of the excess mortality of 300,000 people, this confirms that this is indeed a very serious pandemic, and we absolutely need to respect this virus. The next important thing to take note of is the fact that the CDC estimates that a significant amount, maybe about a third of the excess mortality that we've seen in the United States has not been from the virus itself, but rather from the consequences of the pandemic. So presumably the economic effects and the shutdowns have affected our psychological and mental health. Maybe they've led to an increase in overdoses. Now, this isn't a good thing, but it's something that's important for us to keep in mind as we balance the pros and cons of different policy measures. And we're actually going to talk quite a bit about this today in my interview with Joe Ladapo, so hold that thought. As for the lack of benefit of medications like remdesivir, I'm actually going to argue paradoxically that this may be a good thing. Now, why is this potentially a good thing? Well, we clearly see that the mortality rate for infections is a lot lower now than it was at the beginning of the pandemic. So if medications are not presumably a big driver of this benefit, it suggests other potential good reasons why mortality rates have been dropping. And the most obvious that comes to mind is that the virus may be starting to weaken a bit. This has actually commonly been seen in many previous pandemics. This is how the 1918 flu pandemic ended. Another possibility is because we're all wearing masks and social distancing, the amount of virus that we're exposed to when we get infected is lower. And as a result, we get less severe infections. And there may be some improvements in medical care. Probably one of the biggest is that we are not overreacting to certain patients who have COVID, and we're being a little more conservative about putting them on ventilators. So there's all good potential reasons why mortality rates are improving, even though some of these medications aren't clearly effective, according to the WHO study. Now, finally, in terms of the rising rates themselves, this is absolutely something we need to be mindful of and follow in the coming weeks and months. But the most important statistic that I look at is not the number of infections, but actually the mortality rate and the hospitalization rate. So if we do get a big spike in the number of cases, but we don't see a substantial increase in mortality, that's actually a very good thing. Again, it suggests maybe some weakening of the virus and some of these public health measures are working. So, I think over the coming weeks, it's going to be very important to follow not just the rates of cases, but actually hospitalization and mortality rates. And I think what we observe will really affect the appropriate next steps in response in this pandemic, whether we need to tighten or we're able to loosen some of these restrictions that are in place. So with that, let's jump into our interview with Dr. Ladapo. My first question, Joe, you and I have known each other from medical school, and as I recall, we played in an intramural basketball league against each other. I was on the first-year team, you were on the second-year team. And I just wondering if you could help remind me. I actually do not remember all the outcomes, but how did those games turn out?
They must have turned out pretty good, because when I think of you, Mike, I think of basketball. Like I think of you scrapping on the basketball court, and they are great memories. Those were really fun, carefree days. So those were good times, Mike. I literally, every time I think of you, I tell my wife, oh, he's a great guy. We used to play basketball together all the time. Every time. She's like, oh, Mike, okay, yeah, I know.
Well, I can assure you it's not as pretty as it used to be. Do you still play at all?
No, I love my knees too much. But I jog, I run every day. I used to run or swim, but 3 kids later, the only thing I can do is run.
I get it. I'm with you. All right. Well, the next question I'm going to ask, Joe. So you finished your medical training, and then you took a path towards doing research on how health systems work and cost effectiveness. How did you decide to go that route with your career?
I've always had an interest in policy. And it was kind of a curious interest of mine that maybe started probably quite a long time ago when I was a boy reading newspapers. And during med school, I decided to go to the Kennedy School for a master's in public policy degree. And I really enjoyed the topics so much, especially the economics, the microeconomics, that I was persuaded to pursue a PhD, which was, one of the best academic decisions of my life.
So since COVID hit, you've written a number of articles, I think 5 or 6 at least, in the Wall Street Journal. And if I'm understanding your perspective correctly, you've sort of made the case that we as a society have become consumed, maybe more so than even we should be, by this pandemic, and it's really interfered with what we all do in a very negative way. And maybe it's an overcharacterization to say we've almost been overreacting, or am I understanding your perspective correctly?
Yeah, you sure are, Mike. And you're hearing more and more people say that now. The number of voices that are sharing similar concerns have fortunately grown over time, and there's at least more discussion and debate about what we're doing and what our objectives are. I should add, by the way, that I'm speaking for myself and not for UCLA. I've earned myself that requirement over time now. Yeah, we're making extraordinary trade-offs right now, and the ones that are probably the most concerning, and I don't think will be viewed in a positive light historically, is how we are treating children and young people. With young people, it is how we are literally taking away some of their opportunities to build a life with some of the restrictions. And with children, that one that's the most disheartening. We clearly, it should be explicitly stated that the concerns about keeping children out of school, which some states have taken as a strategy, like California, North Carolina is doing something similar, is not for children's benefit. It is for the benefit of adults, because we have there's tremendous data around the world now that children do really well. The number of children that are seriously harmed from COVID is so very small, and it's no one ever wants to see a child hurt, but it's very small and smaller in magnitude than the risks that they face from influenza. So to think that we can't find a way to get children socializing with each other and learning in school and continuing that critical emotional development that is part of being a child and growing healthily, just because of the concerns of the parents, which are valid, but to think that we can't find a solution is really terrible.
So, Joe, you mentioned that you have 3 kids yourself. How has the isolation impacted that on a personal level?
Yeah, so for us, it's not been as bad as for some families. I mean, early on, we were thinking about the data, and the early data that was coming out of Wuhan already had demonstrated that children were really, fortunately, almost entirely spared from having any consequential health harms from the virus. So from the very beginning, we've had our kids, going to the park, even in March when the shutdown started. Fortunately, we have a park within walking distance. So they've been active. I have 3 boys, and they're very energetic. And so it's really been, and we have a small condo. So to try and keep them inside and not get to exercise outside is just unthinkable. Everyone would go crazy. I don't think we would have made it this long in the pandemic. So from that perspective, it's been good because they've been out. They've also socialized with other kids as the number of kids that were also coming to the park sort of gradually increased from April. And we do the best we can with school. My oldest is in 2nd grade now. But it's really tough. He doesn't have, none of my kids have as many children their age to play with. And it's really important for their well-being. Unfortunately, they have each other, but it's really tough on children, and I think it's really unnecessary.
Well, one thing you've written in the Wall Street Journal is that there's a lot of different factors that influence health besides just COVID, believe it or not, that economics, having a job, being social in an environment with other people, that those all things can contribute. There's social determinants of health is the technical term. So how do you balance the health concerns related to COVID itself versus the impact it's having on these other social determinants, our response to COVID?
Yeah, it's a great question. And I think that one way is through a legislative process, and a process that has more participation than the process that most states, virtually all states, have adopted, which are these emergency authorizations and kind of top-down decision-making. So that's one way, just to have more voices in the room and discussion about more issues than COVID, which is very important, but whether you like it or not, doesn't happen in a vacuum. There are other elements of life, living, the world, survival, happiness that are unrelated to COVID, and whose demands haven't gone away and did not go away during the shutdowns. And we've seen some of the consequences of that. I have little doubt that the increases that have been reported now in substance abuse. There was a paper in JAMA, I think, a few days ago. 2 papers actually in JAMA on this they're a direct consequence of the social climate, of the environment we've created in this country in almost every state in response to COVID.
So one thing that you and I have gone back and forth on a little bit by email and by text is the politicization of this whole science process. And it's amazing that this has gone by party lines, where Republicans are viewed as the party that wants to reopen the economy and Democrats that prioritize safety. But science and policy should be driving these decisions. Do you agree with that concern, or what are your thoughts on it?
Well, in some ways, it's actually better for it to be political because they are political decisions. They aren't just scientific decisions, and the political stuff sort of has 2 levels. I think. So one level is the actual, one level is a reflection of actual values, differences in values, which is a legitimate topic, legitimately worthy of debate and discussion, and legislative process, a participatory process. Another level is just the I'm picking this side because you're on that side, and that level is useless, but is also probably inescapable, especially considering how polarizing the current president has been, and that stuff is it's really unfortunate because there's no value added, but it has proven to be a big part of the of views around COVID and how to respond to it.
Yeah, I actually think that's a really good point you made, that it actually is okay and appropriate for politics and values to be involved at some level, because some of these things are judgment calls. The science can give us objective data, but at the end of the day, we need to put it all together and make judgments and calls about open or not, closed schools or not. And there is some values there too. So that's a good point. That does make me feel a little bit better about some of the politicization, but it is a little concerning how strongly it has gone down party lines, some of these decisions.
It's really phenomenal. But everyone says it's science, though. There's no politics involved. It's always science.
You're right. We resort to these euphemisms sometimes. Well, one point that has resonated in some of the articles you've written, and again, I hope I'm capturing your point correctly, so please correct me if I'm not, is the role of testing. Some people have made a real big deal out of it that, this is the way we're going to get out of the pandemic, test everybody all the time, every day. And you've, raised some cautions about that maybe there are some downsides of testing, and maybe this isn't the one and only magic bullet answer. What are your thoughts on the role of testing in this?
So, it's so interesting, the testing issue. It's extremely interesting. So I've spoken with one gentleman who's Dr. Michael Mina, who is a physician and epidemiologist, very smart guy. And he's one of the people who have promoted wider testing. And it's interesting. We had an exchange that I hope he doesn't mind me sharing. But I assume that he was kind of on one of the people who believed that was the answer. And he explained to me that really he saw testing as a tool to kind of being able to open up the economy while still satisfying the needs of some political leaders to feel that they had full control of the pandemic. And it was a very nuanced position. And so it wasn't so much about the testing, but rather about the outcome of having a society that was, sort of sustainable and livable, which we're not in right now. We're in a very unstable place right now. And we've seen that. I have no doubt it's part of the reason that when George Floyd, tragically was killed, the response, which was so explosive. Obviously, it was an incredible. I mean, it was. I can't even watch the whole video because of the effect it has on me physically. But the response was not only because of what happened, but also because of the circumstances, in my opinion. So with testing, when you have something that that is clearly transmitting, freely through the community, it's hard to the math just doesn't work out in terms of being able to do enough testing in a society where testing is voluntary to bring it under control through testing.
Well, that's right. And of course, that's in flu season. We don't test everybody for the flu. If you have a fever and respiratory symptoms, we just have to make that assumption. Now, this is a little trickier because there are so many people who seem to have asymptomatic infection, and that's why I think what makes more sense just to use good judgment all the time and be under the assumption that you may be an asymptomatic carrier, I may be, and we should wear a mask. And, Dr. Mina's points an interesting one that, there's some optics involved here, and we want to be doing things that show we're taking the problem seriously as political leaders. I get that. But to me, the thing that I might focus more on is the mask use, because in addition to having symbolic value, that's, I think the evidence is showing, has more substantive value than testing.
Yeah, I think that's very reasonable. I think I think that strategic testing has a role. It's tricky because even with PCR, we know that there are levels at which people may be contagious, but not quite detectable yet. But one could imagine scenarios where testing allowed for activities to happen. And in fact, we're actually seeing that. So we're seeing that with the football, college football, for example. And it was always a possibility. I'll say one other thing about college football. It was a demonstration of how a lot of what is called science is actually about priorities. So now, UCLA, I think, is going to get to play football. And that's because California is changing its rules. But the pandemic has not really changed. What changed was that UCLA and other schools in this conference out here saw that their brothers were getting to play football, and the obvious question is, well, why can't we play football? And so priorities changed, and that changed the plan. And that's what happened. The science didn't change. That was essentially a political decision. And in fact, all of the closures are political decisions.
Yeah, and I think you said it exactly right. I don't think either of us is saying there's no role for testing. It just, we want to be strategic about it. Use those tests where we're actually going to make decisions based on the results and not just do it for the sake of testing. That actually gets to the last question I have about testing. So there's been a lot of interest in these home-based tests that are like home urine pregnancy tests that someone theoretically could do several times a week, and if they're positive, then they would know to quarantine. Do you think that that's going to be a viable option and an effective strategy? Yeah.
The rapid testing seems to be coming. As an effective strategy, I think it's trickier. I think that it will. I do think it has utility, especially say with businesses trying to streamline their monitoring processes, for example. But I don't think it's any pandemic answer. I think it's a sort of livability answer in terms of making more things available to more people. But so I think it has a role, but it's not a panacea. And one does have to just think carefully about what it means to test daily for something. Is there any adverse consequence of that to well-being, for example? So, and there may not be, but it would be good to be thoughtful about the decisions we make.
So, Joe, I wanted to touch on one other controversial topic. This is one that, while we may see it a little bit differently, I've really appreciated and respected your opinion as someone who's tried to take this question on from a scientific angle, and that has to do with the drug hydroxychloroquine. And it, gets at these issues of what data shows, and just because something doesn't show it works, does that mean you throw it out and ignore it entirely? Clinical experience versus what the research shows. What's your take on hydroxychloroquine and the potential role for it in treating COVID or preventing it?
Yeah, great. Yeah, talk about controversial issues. So my perspective has changed. So initially, I didn't think it worked because there were lots of reports of side effects, no reports of effectiveness that I saw, and that was my impression. But Mike, I think you may agree with me that it's been extraordinarily curious how people who did believe in it, doctors, regular board certified doctors, just kept saying it worked. despite this randomized control evidence that was finding that it didn't work. So with that, I kind of have been listening in to some conversations, and literally, I think it was last Tuesday or Wednesday, while I was on inpatient service last week, a few of us, so Harvey Reish, Peter McCullough, and a fourth gentleman, John McKinnon, started talking about putting something together, and in terms of meta-analysis. And these studies of early outpatient use, they all fall on the helps side, but the confidence intervals cross over unity, so that statistical significance wasn't reached. And when you pool them together, the outcome is statistically significant. So that's a big deal. Does it prove that it works early? It doesn't prove that it works early. But it does prove that based on these particular outcomes from the 5 randomized controlled trials that we use, statistically the evidence favors benefit, and that benefit was estimated to be around 24%.
Well, I have to say you've certainly opened my mind on the topic. I tend to err on the side of caution. I tend to be a stickler to evidence, but I also think I appreciate what frontline doctors see and hear and do. And, certainly as a practicing doctor yourself, and I am too, I see both sides of the equation. You have to balance the evidence and what we're seeing on the front lines. And it's great that you've been able to try to push ahead and get the data. And I really think, it is still an open question. Maybe there is a right dose that will prove effective. The new study that you did does suggest that there is a possibility of that, and we're just getting mixed results. Well, at a personal level, you've written some controversial, and in my opinion, very thoughtful, but controversial articles in the Wall Street Journal, and now some of the work with hydroxychloroquine. Has anyone criticized you for speaking out on this?
No one's criticized me at all. It's been really, just a
smooth riding.
Smooth ride. I've received a lot of criticism and attempts to silence me, and some unpleasant things, but it's really tough. That being said, it's so important. I mean, the world's been turned upside down, and it's important to be, honest, to be truthful, to have integrity, and not to live in fear. Those are so important. So it's not going to change. All the negative sort of energy that's come my way will not have any effect on what I do. And it's fair to add that for the negative energy, I've received some of just the unbelievable in their kindness, just the kindest words and the most appreciative words from people around the country. Just very touching notes and appreciation for voicing a perspective that, again, we're hearing a little bit more of now, fortunately, but was completely absent when this started.
So my final question for you, Joe, is if you were in charge, what would be the number one policy change that you would implement to get us moving in the right direction with coronavirus?
I think the main thing is I would try to help people think about who's high risk and what we can do to protect those people better. So whether that's targeted testing, targeted PPE, I think that's what I would do. Really shift focus to people who are most likely to be harmed. And I think that's a sustainable approach, and it frankly probably would yield comparable health benefits, if not better.
Yeah, I agree with you. I think if there's one mistake we've made is we've focused too much on healthy, low-risk individuals and not done enough to protect the high-risk, vulnerable individuals who are older and who have chronic diseases. So I certainly agree that that's a shift we need to keep in mind. Well, Joe, I so appreciate your joining the Healthy Skeptic MD podcast. I've really enjoyed your perspective in the Wall Street Journal and talking with you throughout the pandemic. You've added and broadened the scope of this discussion, and you haven't been afraid to get new ideas out there. And all I'll say is keep it up, and don't let the doubters get in the way. I mean, I think what we want is exactly what you said: a healthy discussion with different perspectives, and then we can all make our mind about what is best, even if we don't all agree on it. So thank you so much for that and for joining me today.
Always a pleasure, Mike, to see you, my man.